Hey everyone, thanks so much for joining me on the Slice of Healthcare podcast. I'm your host, Jared Taylor. On today's episode, I'm speaking with Allison Reichenbach, the president at Interlace Health. Allison, how are you today?
Hi, I'm doing great, Jared. Thank you so much for having me.
Absolutely, I'm pumped. We're excited to talk more about Interlace Health and learn more about your background. I think we should dive right into it. I'd love if you could tell the audience a little about your background, and then we'll talk more about Interlace Health.
Yeah, absolutely. So my background was not in healthcare technology at all. It was quite the opposite. I majored in English in college, came down here to Nashville to go to law school at Vanderbilt, graduated from law school, started working at a law firm, and realized that my passion was really around solving complex problems, but in more of a team environment. Unsurprisingly, being in the legal field, it's much more of an adversarial environment, right? And was really looking for a way to take my law degree and do something else with it. And Interlace Health is our family's business. So I had no interest in working for the family business. I, used to get paid a nickel per folder to stuff pamphlets out in the garage for the company back when I was in kindergarten and first grade. But it really was not something that I was interested in pursuing. But the company has been growing over the last 30 years. It was an interesting opportunity. And so I joined the company back almost 10 years ago now, and found out that I really do have a passion for healthcare technology. Started out kind of staying in my lane in terms of employment law, HR, and staying on that side of the business, not really getting involved in the technology, in the development realm. But over the last decade, just kind of putting a toe in the waters of each department, getting to know the business, building out some of the pieces of the organization that were important to me in terms of benefits, in terms of increasing the number of women we have in the company. We now have 50% female executive leadership in the business. And over time, learning the technology and realizing that it's not as intimidating as it, I think, originally appeared to me. I think for a lot of people, technology sounds a little scary, a little intimidating, and it really is just, back to what I was first interested in, solving complicated problems.
When was that point where you're like, you know what, I really do like this, and even though maybe I didn't see it as kind of a long-term maybe career for myself in the early stages, you do now, right? When was that point? And only if you can share it. I'd love to learn more about that.
Yeah, I don't think that it was one, moment in time where I thought, wow, I really do have a passion for technology. I think for me, it really kind of hit home over time speaking with our customers. We have 1,100 customers in healthcare, a huge footprint, mostly acute care hospitals and their ancillary clinics, outpatient facilities. And I'm a people person. So getting to talk to our customers and realize, oh, wow, our business is making the lives of our customers easier. We're not just talking about, what I knew of the business growing up when it was an electronic forms company was, okay, we're saving hard costs on paper. You don't have pre-printed forms anymore. Cool. But, as we've evolved into an enterprise level document automation company that spans all sorts of use cases and workflows through the hospital, we're not just cutting those hard costs. We're freeing up staff time. We're improving that patient experience. We're, helping to eliminate a lot of that human error and improving compliance. And healthcare is a stressful place to be. I'm sure, talking to your customers as well, it's stressful. And so anything you can do to make that daily grind a little bit easier is hugely impactful. And so I think that's when I realized, oh, wow, I really do have a passion for making people's lives easier and for solving problems. And technology is just a means for us to do that.
Absolutely. Yeah. And can you dive into a little more about how Interlace Health currently operates today, and the value that you provide to your current customers and prospective customers?
Yeah, sure. Absolutely. So, I think one thing that those of us who have been in healthcare a long time and Interlace Health, formerly FormFast, we rebranded, has been in the business for 30 years, is that healthcare is sort of all across the spectrum in terms of technology advancement. So we still have customers that are just printing forms, pre-filling forms, putting them on clipboards and scanning them into their EHR, all the way through to customers who have very advanced workflows, who are using our solutions to handle informed consent, to do patient intake both remotely and at registration, to handle clinical trial consents, downtime. And so I think that the biggest value that we're able to bring to the market is, there's a few things, but we're able to meet them where they're at. If you're at this sort of level of technological advancement and maturity, we can be there with you. And I think, there's a lot of buzz around digital healthcare right now, a lot of investment going into digital healthcare. But, I think understanding that a lot of healthcare is a little further behind than that. And can you meet those customers where they're at as well and help bring them along that timeline is really important. And we're able to do both because we know healthcare. Healthcare is all we do. We're not in other verticals. This is what we've been doing, meeting with customers, understanding what their day looks like for 30 years. And that's no small thing in healthcare, because I think, as you've probably seen in your business with Black Health, with credentialing, healthcare is sort of where complex processes are created, right? Something that should be very simple, all of a sudden, you slap healthcare on it and we find ways to make it extremely complex. And so the more that we can help smooth those edges, I think the better. But a lot of companies that I think are deciding to open healthcare verticals now and move into healthcare because it's sort of hot, not to sort of throw aspersions their way, but I do think there's a lot of healthcare specific knowledge that you have to really be able to serve those customers well.
Yeah, I always tell people that healthcare is a space where the phrase, "we've always done it this way," no matter how bad the process is, I hear that phrase probably several times a day, or at least several times a week, depending on if we're talking with like new customers or not. And getting people past that point, I think, is getting a little easier now. I think people are more open to change if it's going to help them save time on some of, maybe important areas of their business, but there's definitely more important areas that they could address if they had these off their hands, these certain roles and stuff. So we're all about that too, trying to help them save time and adapt their processes so that they're not wasting time on I don't want to say stupid stuff, but like stuff that is not their core focus, right? Which is a big part of what happens in healthcare.
Absolutely. I mean, it's about patient care, right? And it's become about documentation and administration, but allowing them to focus more on that patient care is what all of these technology companies are out there trying to do. So I think that's definitely true. And we've always done it this way. Okay, maybe we automate that process sort of as you envisioned it for now, but the big piece that we have to bring in with our services is change management. Because if it's not easy, if it's not, especially with the physicians, if it's not easier than what they were doing before, you're never going to get that buy-in. And so it's really important to manage that change and bring them along for the ride.
And once they go along for the ride, they're excited they did, right? That's
exactly right. That's the goal for sure.
Well, I'd like to shift focus a little bit. So you gave us, obviously, your background. We talked a little bit more about Interlace Health and kind of how things work today. What are some of the things you're really excited about as we move forward, right? We're halfway through 2021. What are you excited about in terms of the business for the rest of the year, and then maybe even a farther outlook after that?
Yeah, absolutely. So, I think one of the things that I've always really valued about Interlace is we are a privately held family business. So it's provided us a lot of stability to do long-term planning, right? To look into the future more than sort of having that stress of meeting quarterly demands of investors and shareholders. We can say, okay, you know what, we're going to take our time. We're going to look long-term. We're going to figure out how to build a business that's going to carry us into the future. And innovation doesn't happen in sort of that stable environment, or without that sort of stable environment, I should say. So I think that has been brought us to this place we are today, where we're essentially doing some rewrites of our core technology, and building out a unified platform. So today, all of our products work beautifully together, but they're in different code bases. They're sort of in older code, right? And so what we want to do is unify all of that onto one platform. And so now that implementation is more quick. We can bring cloud hosting to the table for our customers. That's something that I think we're seeing a lot more of. And so that way we're able to more easily target smaller customers, to more easily provide additional functionality without having to do an entire new implementation. And so, with the way that things are built out today, we're having to go in and implement new solutions as they come up and work through that. But ideally, we get to a place where it's really just the flip of a switch. We're hosting, we're providing managed services for those solutions. And so it's kind of off the plate entirely. And so that's where we're moving towards. We're in the process of building that unified platform right now, rolling out first solutions end of the year. Obviously continuing to support all of those classic solutions that we have. As I mentioned, we've got 1,100 customers using those solutions, and they bring a lot of value, but I'm loving the sort of cleanness, I guess I should say, cleanliness of that unified platform that really just allows us to implement more quickly, and to, once a customer is already buying in, add that functionality much more quickly.
Why the focus on acute care hospitals? What is it about that particular customer set that you really like, or that really makes sense for them to want to work with you?
Yeah, so I think a couple of things. First, when the business was started 30 some years ago, that was really where healthcare was happening, right? So, that was our background, was acute care hospitals. And they are a little bit of a different animal in terms of technology adoption, in terms of that change management. And we've gotten very good at that. But, I think the future of the business we'll keep servicing our acute care customers, but I think moving into those provider practices, those surgical hospitals, those outpatient clinics, that's where having sort of a lighter, more agile platform is going to allow us to approach those markets more easily without kind of the heft of what we brought to the acute care market. And so we love our acute care customers. They're our core, right? We understand them through and through. But I do think, and you've probably seen as well, that care is moving outside of the four walls of those acute care hospitals. And so we need to be able to adapt to that and make sure that we're meeting healthcare where it's going. Because as I said, we're a healthcare business. That is our vertical. That's where we stay. But healthcare comes in a lot of different flavors, and that keeps expanding out. So, with what we're building now, we can address telemedicine needs as well. Partnering with some organizations to do that. As I mentioned, partnering with some cloud hosting security organizations. ClearData is the organization that we're partnering with. And so making sure that we're not left behind sort of living in the brick and mortar care provision. But at the same time, there's always going to be a need for that. So kind of keeping a foot in both places. But I think we're doing it well. Absolutely.
Well, I appreciate you coming on the podcast today and talking more about yourself and Interlace Health, and thank you for answering that question about why acute care hospitals and where the focus maybe will be as we head into the future. But yeah, thank you so much for coming on the podcast. Hopefully we can have you on again soon.
Thank you so much for having me, Jared. I appreciate it.